Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. Fez Mkhize, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect show. Let's go. Welcome back to another incredible episode of Medshield Movement Connect show with me, Dr. Fez. Now, I don't have kids as yet, but I want to make sure I'm always on the precipice of all the information when it comes to them. And we have a pediatrician here who knows anything and everything about kids, Dr. Futhi Mahlase. Thank you so much for sitting down with us, Doc. I'm very excited to get into the pediatric space and especially kind of breastfeeding.
Thank you for having me.
Before we do get into that, I always like to ask, what made you fall in love with healthcare, with being the kind of a doctor and looking after people?
So for me, being a doctor, I always say that I don't think I had a choice.
Makes two of us.
So my parents, I don't know, for as long as I remember, my parents, it was almost like you were going to be a doctor. You were going to be a doctor. We used to visit Pretoria, my grandparents' place, and whenever we passed by UNISA, you know, it has very huge lights. So my parents would wake me up on some, this is where you'll go. And I'm like, now that I think back, I'm like, UNISA, really? But I think it was the ingraining that you are going to go to a big place like this one. So for me, really, I had no choice, if I were to put it that way. I had to be a doctor. It was spoken into my life at a very young age, and that's what I grew up knowing. And funny enough, when starting out, I actually enjoyed it. I liked it. And for pediatrics, though, it's something I just fell in love with. But also because, you know, when you go into, like, as a female, short, you go into a male ward, you know, you'll be there, it's like sister, and you're like, or you get there, you explain everything, and then they're like, so sister, when is the doctor coming? And I'm like, okay, this is not cutting it for me. So for me, pediatrics, I feel like I fit in nicely. I have a gentle personality, so it goes in very nicely with that. So yeah, so that's where
I love that you're like more petite, and then the pediatrics, I feel like you're like, I fit in there nicely because
yes.
okay, no, fair. That's always make a quality of life decision, I always say.
True.
But when it comes to kind of specialities, and I tell the story as well. My mom used to always kind of tell me, it'd be nice to have a doctor in the house, and always used to feel like, no, ma, I love you. You look after me. I'm gonna make sure there's a doctor in the house. And now it's me and my brother, so she's very good when it comes to just gentle nudges down the right path. When was it that you realized that you really loved it? One, because I find that people don't specialize unless they find that they do actually love it, as much as they might be directed down the path. And when did you know it was going to be pediatrics?
So for me, it was the last year of my internship, actually. I was actually glad that my last rotation was peds. And I think also the person that we had there as a consultant really made us fall in love with pediatrics. Whereas most of the time, pediatrics was, yo, it's scary, there's this drips, there's this more people. But she really made it comfortable for us, and you could literally see yourself as a pediatrician through her. How she advocated for children, for example, where I worked as an intern, when she came in, there was no designated space for pediatrics in casualty. And she created that space so you knew exactly when you were being called for a pediatric patient where you would go, where things were appropriate things, you know, for drips, masks, and things like that. So what she created, or what I saw from her, was she created space, she created a place for us where you could actually go and you could see yourself as a pediatrician through her advocating for children's rights, children care, you know, even the pediatric ward. When she got there, she made it beautiful. Like she went around, we were in spring, so she went around the company. She's like, listen, we have a pediatric ward, we need paint, we need this, we need that. And I was like, oh my God. So just looking at her and that leadership, that qualities that she had, for me, it's something that I could look at and see myself in and identify myself with that. So that's when, for me, I fell in love with pediatrics. And ever since that rotation, it was pediatrics throughout my life. I haven't gone back.
Veered from the path. But I
No,
think
no.
I always say it's like a funny thing because people talk about the occupation of being a doctor and nurses and just a healthcare practitioner in general
Yeah.
is a vocation because it's not just about I come in from this time to this time. You are somebody who gives your time. You're somebody who goes that extra mile because you're about trying to make sure that you hit the targets that you want when it comes to caring for people.
True.
And I can tell that you really did have an effect on you because even when you're explaining it and you're thinking about it, I can see you just looking back to it and being like, yeah, that's who I wanted to be like and kind of
True.
take over the mantle.
True.
I will ask though, we work and you've worked within the public space, you've worked within the private space. And as somebody who is a specialist, and especially when it comes to kids, what are some of the difficulties that you found when it comes to being a pediatrician and trying to give the best possible care in sometimes under-resourced spaces?
I think for me, one of the biggest thing is that when you have to choose, you have two, for example, you have two children and they both need ventilation, and then you have to choose because of, you don't have enough resources, and now you have to choose which one gets it and which one doesn't, and having to go through a cascade to see, what is available, what can be offered. I think for me that was a very big challenge. But what I seeing more and more now is that more and more doctors are coming in groups. They're not just relying on the government. They're not just looking at what the CEO, the hospital manager can do. I mean, just from example, what I learned from my the pediatrician that was assisting us at that time when I was an intern was, I mean, you are a community. This hospital is serving a community. You have companies, literally companies around you, and most of them will not say no. You just come and say, we need paint. You just go and say, we need sheets, we need this, we need that. And you'll find that more and more people are actually willing to give if they know what they're giving to and when they see the difference. So I feel for me that made the difference, and that makes it easy to say, okay, we can advocate for our patients if something is not available within. I mean, just this past weekend, there was a run
Yeah.
by pediatrics. Mostly it was pediatricians, just to raise funds for one of the big hospitals for recliner chairs for the moms. So I find that more and more people are now starting to do that, not just relying on, the funds from the government, but to say this is where we work for us to make this comfortable for us and to, serve better. There are things we can do outside of just coming in, doing your rounds, but looking at what are the needs of the patients, what are the needs of the moms. If I come in here, do I feel proud when I look at this space? Am I comfortable in this space? And I find that more and more hospitals or doctors are doing that, but not individuals, but as groups.
And I love that you said that the community element of it, bringing
Yes,
people into
yes,
it, making sure that we're all part of improvements or bettering the
yes.
care.
Mm-hmm.
Speaking of care, we are very much wanting to break down misconceptions and also give information around breastfeeding. I know you're a
Okay.
mom, so you probably have your own experience
Yes.
around that.
Mm-hmm.
Could you please tell me some of the bigger misconceptions, first and foremost, when it comes to breastfeeding, especially for newer moms, just so we dispel that off bat?
So I think one of the thing that's brought out is that breastfeeding is easy.
Mm.
It's not.
They always make it seem like it is a natural
No.
thing, like it just kind of
So
happens.
it is a natural thing, and yes, thousands of mothers do it, but there's somehow a technique and there's a way of or a science to it, in the sense that um, okay, I'll talk about my own personal experience. So my first child, we were breastfeeding up to about 3 weeks, where I realized we were having issues every time my son would breastfeed, my nipples would crack.
Mm.
And we then discovered he had a tongue tie, and that had to be sorted out. We tried for a good 6 weeks, and what helped me to even persist and go on for that long was that I had good support. So I find that more and more moms don't get that support. There's a new baby already, there's like 10 people coming in to see the baby every single day. And these are not people coming to bring you food or help you.
Yeah.
They're coming in to literally see the baby. And then, it's like, even when you have to now pick up your baby and breastfeed, it's uncomfortable because, we don't create that environment where moms can actually bond with their kids, sit with their kids. If I need a nap, if you're coming to visit, you'll actually be coming to, look after the
Help you.
baby,
Yeah.
help me. But it's more like, no, now I have to dress up, I have to make lunches. Like we get so busy
True.
and we, lose on sitting down and just bonding with your baby and easing into this new person, me, what's best for me. Is it better if I hold you this way? Is it better if I, sleep, or what it is, just so that we get to me and you bonding and then establishing breastfeeding.
Sure.
Yeah, yeah.
And I have to, so this is kind of, it's funny because I know conceptually some of the things that we can kind of talk about, but even reading through books, having been with an obstetrics wards, it's generally experience that's always going to win out. So mothers who will come in and they'll be like, I don't tell this is actually how I did my child. So I'm going to help be it the grandmother who's helping the younger generation, and they'll be like, this is how you'd want to do it.
Yes.
But of course, we have to start with something. In
Yes,
terms of latching, so actually having the child being able to attach, what are some of the principles around that? And how do you know when you have a good latch?
So with latching, so one, I always advocate that moms must be comfortable. So you can't be sitting and, cramping, and then, you're in pain, and it's not going to work. So I always say, find a comfortable spot, whether it's in a chair or on a bed, and always support your back. So there's simple tricks, like, for example, if baby's going to latch on this breast, you take that same leg and then you'll cross it over. Or if you can't cross it over, like if you try it now already, your back becomes straight.
Oh, yeah.
Yes, you can't follow, so that helps you and support your back. And then there's the normal cradle hold, where the baby's head will sit on the elbow and this hand will hold the baby's bum. I wish we had a doll. And then this hand will hold the breast.
Here we go. There we go. We go.
So then you hold baby like that. This is the head, this is the bum, and then this hand will help in holding your breast. And also now we've moved from, people will use the scissor or pinching, so that sometimes closes the ducts. So the main thing is that you are holding your breast, that it doesn't cover the baby's nose. So that's why you're holding. And then the other way is if you do like a cross cradle. So with the cross cradle, you will hold this way, still the same breast, but now the head is here, the bum is here. So this hand is now on the head, and the elbow is where the bum is. And then there's also like the rugby ball or ball hold, where you kind of hold the baby this way.
That is a unique one.
Yeah, so the head will be here and the bum will be here. Usually I advocate for this one if moms have big breasts that they feel they are, they're not sure if it's going to cover or suffocate the baby. So I find this is easy because they can see the baby's face and the baby can see mom. And it's a nice way of bonding, because the whole point of it is that, you get to look at your baby, they look at you, and you're comfortable. And then also what I always say to moms is that when the baby's comfortable and latching, so the other trick is that, aim for when the baby's opening their mouth, because then the areola, which is the darker part of the nipple, that's where they need to latch on. So they need to latch on that whole thing, not just the nipple, but on the areola, because that's where most of the ducts would be. And also how the baby's mouth open, so the lips and they have to be upturned. But that obviously happens with if the baby opens their mouth, so you can't really now be you have to. So some of the things that may impact that is that, for example, if you have a lip tie or a tongue tie, then the baby might not be able to actually do that. So that's when like lactation specialists come in, or even sometimes doing a tongue tie release or lip tie release. So just back on, sorry, even with latching. So also looking at the baby's cues. So if you hold the baby, most of the time you'll hear mom says, no, this baby doesn't want the breast, they fighting. So usually if they're like that, it means either they're uncomfortable in the position that they're in, or they just simply have gas. And all you have to do is just pick them up, burp them, and then try again. And you see, if baby is comfortable, mom will be comfortable. Or if mom is comfortable, baby will also be comfortable. So, who's around you and the information that you're getting and all the voices you're hearing around that, also influences how comfortable you are. That's why I always say, have the people you are comfortable with the most. Even when they come and visit you or take care of you, between your mother-in-law and your mom, someone who will be able to make you food. I always say that is the best person.
To the heart, way to the heart. Yeah.
True. Yeah. So, so mostly those are, just with the latching techniques.
Yeah. You know what I love even as you explain, and you've kind of hit this point each and every time, mother's comfort is essential, because that then, I'm assuming, will translate to baby, and then baby, if mom's not feeling comfortable, baby's not going to feel comfortable,
True.
and then the whole environment isn't going to be conducive
Yes.
to having a good breastfeeding experience.
Yes.
But
True.
you did say when you were breastfeeding, there was issues around kind of cracked nipples and all of those kind of
Yes.
byproducts, I guess, of sometimes trying to breastfeed. What are some of the things you could do for cracked nipples? Because I know I, as an intern, was always trying to research the best ways to assist patients
Yes.
who would come in with that issue.
So usually what I mean, there's a lot of nipple creams out there.
Yeah,
I have my personal favorite, but I
but
won't mention the names.
yeah,
But the main thing is, one, if baby latches well, and in the first few days, baby will latch, more often. And then what I find also, even just breast milk itself, if you just express breast milk and you rub it there, because breastfeeding, breast milk has healing properties. So that also helps with that. Sometimes you may need to air dry them, but also depending on how badly cracked they are. There's also I can't remember if it was LED lights or infrared. It was infrared lights. One of the physios actually was using that to help me with the cracked nipples. Yeah. So there's a lot out there that you can use, like, just from your breast milk to emollients to air drying, or even that infrared light that I was talking about.
But I mean, this is also why you make sure you have the correct community around you,
Yes,
you have the
yes,
correct health practitioners, so
yes.
that you don't also have to think about all these modalities, I guess, when you're trying to
True,
figure out the
true,
one that works for you.
true.
We are in a working environment. You are somebody who's a professional. Moms have to be busy. They might not have as much time as they might want with kids. The discussion around formula, express, benefits, pros, cons, when you are speaking with a mom, especially a new mom, would you say you're more formula or against, and what the benefits would be?
So I'm always pro breastfeeding. One, because also just the benefits of it, they really outweigh, in terms of, if you compare breastfed
Yeah,
babies versus formula fed babies. But also we do know there are certain instances when mom can't breastfeed for whatever reason. So in that case, I do offer support to say, this is what you can do. But just from a benefit of the breast milk, just the short term, usually, it would be for brain development, for their immunity, and long term, it can actually help them prevent your chronic diseases like diabetes and obesity, which is quite rife in our community now. And it also has benefits for the mom as well, in terms of mental health, in terms of bonding, as well as preventing or helping to prevent breast as well as ovarian cancer, and also helps with preventing osteoporosis later on. So for both baby and mom, there are immediate benefits, and for mom as well, weight loss, because it's a huge thing.
Love it. I guess the weight loss cannot go without the weight loss.
So breastfeeding helps with weight loss, and it also helps the uterus to contract, so you don't get a lot of bleeding post delivery. So usually I lay down those benefits to say these are the benefits, and then obviously you would get the correct assistance around. And then also, I feel making them aware of the possible complications or issues. I mean, by day 3 or day 4, your breasts can be engorged and very sore, and how to treat that. You can either pump, or you can do cold compressions. I mean, my mom, I remember my mom brought these huge cabbages, and they were frozen.
Yes, I've seen the cabbage bras.
Yeah, so I mean, now people have ice packs and all sorts of things, but yeah, you can still use frozen cabbages. So that sort of helps to relieve the pain, and also making sure that the baby latches well and drinks and empties the breast. That also helps, because then you don't get engorged, and then you don't get, because what we don't want is mom having mastitis.
Of course, yeah.
Yeah. And then when it comes to now you want to go back to work, I always ask, how's your work environment? Because that matters. I mean, I had a lady who said she works in the mine, and, that becomes near impossible for you to pump. But what we did with that mom specifically was, okay, in the morning she expresses, and I find, sorry, when you express in the morning, that's where you get a lot of your milk. So for her, she would breastfeed, and now newer studies are advocating for babies starting to be weaned around 4 months, 4 to 6 months.
Okay.
So which is why, and most maternity leaves is about 4 months. So you can start your weaning process during that time. But obviously, milk is still a huge part of the baby's diet. So she would breastfeed then, express, she would go to work. When she comes back from work, she would breastfeed. But if you in a place where you have a work environment that supports you expressing, I always say you can express, have a cooler bag where you, and storage bags where you have. So there's plastic containers, there's bottle containers that you can put the milk in. You just label it nicely on when you expressed and the time, and then you can put it in the freezer. If milk stays in the freezer, it can stay up to 6 months, and then you just defrost. So obviously, and how you defrost, so you say.
What? Yeah, no. Listen, that piqued my interest. I've never actually discussed
So,
freezing. Yeah.
yeah. So if for example you have milk that's frozen, the importance of having the date is that what you put in first, that's what you'll take out first. Yeah, and then what you will do is you'll have a container of hot water, warm water, and then you put the milk packet or bottle inside, and then you let it thaw, and then that's how they will they will feed. But always test, obviously, like with bottle feed,
course,
yeah,
yes.
if
Make
it's
sure.
hot enough, yeah, or warm enough, yeah.
I mean, listen, I'm not gonna lie, I've never actually had a discussion around freezing and then de-thawing and making sure that it's there. 6 months, that's now, as somebody who doesn't have kids, but I also just want to make sure I have my information correct. So there are studies and kind of trials now that are finding kind of 4 to 6 months is where you can start the weaning process.
Weaning process.
How long can you actually breastfeed for?
So usually it's advocated that you breastfeed for up to 2 years because
Okay.
you get the maximum benefit then.
Okay.
But obviously, it depends on how. For example, I'll say for myself, for my first child, I could only breastfeed up to a year because the issues that we encountered was by 6 weeks I was like, this is not working for us. But I started expressing. So I would express, I would be at work expressing, and then I'd Uber the milk.
That's
And
Uber delivery. Wow.
yes, and at that time there wasn't even Uber delivery, so it would be like this person who comes to collect the milk, and I'm like, it's just milk. It's like, what is in the? I'm like, it's just milk. You're just dropping it
I
off.
love that it's by any means necessary, and Uber Eats is going to be very
true,
proud.
true. So sorry, I wasn't meant to mention Uber or anything, but anyway, but that's what it came down to that we had to. So for me, it went up to a year, and then at that time I had to write my exams. So between now. You're studying, you're doing practicals and whatever that you're doing, and then now you have to pump. It was becoming more strenuous for me than it was enjoyable.
Sure.
So I always say to moms, you do what you can. If up to 2 years, that's great. If it's up to 4 months, if it's up to there's still some benefit. So the earlier weaning actually started more when we were looking more and more at children with allergies and food allergies to say, what can we do to curb this? And we found that one of the things was, yes, you can introduce food earlier, breastfeeding, and also now, you have, especially in the private sector, a high Caesar rate. And now there's more and more formulas that are trying to mimic breast milk. So there's a lot happening with that to say if you, for some reason, you happen to have a Caesar, you are unable to breastfeed, there are some formulas that are trying to mimic and help that, but more and more, if you're unable to breastfeed. But if you are breastfeeding, weaning, you can start weaning early. So there are certain cues also before you start feeding the baby. So what we generally look at is, can the baby sit up or support their head? So usually by 4 months, most babies would be able to. So usually I would say let your pediatrician have a look at the baby first before you decide. And then cues that you can look at as a parent is the child interested in food? I mean, you've seen those videos of kids who open their mouths and and someone else is eating. Is a child interested? And also there's something called the thrust reflex, where if you put in food, they spit it out. If by 4 or 6 months that actually goes away. So those are some of the things that we look at. And then also the consistency of the food you start with is different. So that's why we would use puree, because this was someone, who was drinking my introducing puree. And as they grow, the texture changes as well.
Sure.
Yeah.
I mean, clearly, this is a discussion where we're going to have you coming back, because I'm always interested in trying to find the best way to introduce nutrition, but also just some of the milestones that you're already talking about is a whole other discussion
True.
around kind of what's happening musculoskeletally and the neuropathic kind of pathways. But that means you have to come back for round 2. So that means
Sure.
we got to shake on it.
Sure, no
You've even got the
problem.
baby. I love that you haven't let the baby drop. You've been very considerate about it. And there you have it. Dots that needed to be connected, from how does you help baby latch on to the things that you need to make sure that the environment is conducive to baby breastfeeding. First and foremost, mom being comfortable and everybody who makes her feel comfortable. It's probably the best take-home message I've seen. That's another episode of Medshield Movement Connect Show with me, Dr. Fez, and hopefully you're might be breastfeeding right now and you've just improved your technique. The rugby one's the one I think you should try maybe. But we'll catch you on the next episode and hopefully we'll see Doc very soon.